Keraring, intrastromal corneal ring segments, are implantable devices for the correction of corneal surface irregularities and reduction of refractive errors associated with keratoconus and other corneal ectatic disorders. Unlike other intracorneal rings available, Keraring was specially designed for the treatment of corneal ectatic disorders. Keraring is made from clinical-grade PMMA and is presented with one ring segment per box. The segments have 5 mm in diameter, variable arc length and thicknesses, so as to suit the needs of each individual patient. Mechanisms of action. Keraring acts upon the cornea through 5 different mechanisms. Corneal flattening. Keraring implantation is an additive technique that causes corneal flattening, reducing the cone-like shape. Keraring spares the central cornea and the tissue's integrity. Corneal topography regularization. Keraring implantation regularizes corneal surface distortions while preserving the cornea's natural prolate profile. This regularization effect reduces corneal optical aberrations, improves the visual acuity, and the patient's tolerance to contact lens wear. Corneal apex displacement. In keratoconus patients, the corneal apex is usually decentered in relation to the central pupil. Keraring implantation displaces the corneal apex toward the center, improving corneal optics and visual acuity. Cornea stabilization. Keraring's long-term follow-up, which exceeds 15 years and over 100,000 eyes, suggests that the vast majority of patients presents a stabilization of the cornea following Keraring implantation. This stabilization can delay or avoid the need for corneal transplantation for undetermined time. Refractive effect. Keraring's corneal flattening and regularization properties cause a reduction of myopia and astigmatism as a beneficial side effect. However, Keraring surgery should not be considered as a refractive procedure because many patients will still require glasses or contact lenses after Keraring implantation. Indications. Correct indication for Keraring implantation requires complete ophthalmological examination, in addition to corneal topography, tachymetry, and subjective manifest refraction. In general, Keraring implantation may be considered in the following cases. Patients with keratoconus with poor spectacle-corrected visual acuity and intolerance to contact lenses. Patients with progressing keratoconus observed through sequential corneal topographies. Patients with pellucid marginal degeneration. Patients with corneal ectasia following LASIK, PRK, LASIK, or epi-LASIK surgery. Patients with unstable corneas and irregular astigmatism following radial keratotomy. Patients with previous penetrating keratoplasty and high irregular astigmatism. Patients with corneal surface irregularities after trauma. Contraindications. Acute keratoconus with keratometry reading greater than 70 diopters. Corneas with large central opacities. Eye drops. After penetrating keratoplasty, when the graft is decentered or sutures still in place. Atopic patients with severe eye rubbing habits. Recurring corneal erosion. high expectation of uncorrected emetropia. Keraring advantages. Clinically proven safety and efficacy. Keraring holds the largest history of use and longest follow-up in the world. Over 100,000 eyes implanted in 45 countries, with follow-up as long as 16 years. Independent clinical studies confirm Keraring's safety and efficacy. Reversibility. Keraring may be explanted at any time, allowing the cornea to revert its preoperative shape. The procedure is reversible. Adjustability. If necessary, topographic and refractive results may be adjusted by exchanging or repositioning the implant. Quick visual recovery. Keraring's minimally invasive surgical technique allows the patient to quickly resume regular activities. Topographic and refractive changes start right after the implantation, and stable results are achieved within 3 months on average. Exclusive prismatic design. Keraring's unique design generates a prismatic effect by which the light refracted in the implant is reflected out of the eye, thus reducing glare and halos. Greater refractive potential. Keraring's design and implantation zone provide greater potential of refractional change, allowing correction of high degrees of myopia and astigmatism. High patient satisfaction. Patients report high satisfaction levels following Keraring implantation, with very positive effects on their quality of life. Patient preparation. Contact lens wear should be discontinued 2 weeks prior to the last preoperative examination. Corneal topography is an essential part of the preoperative preparation. Any corneal topographer may be used. Prefer axial topography maps. It is important to take the manifest refraction as accurately as possible. Do not use autorefractometers. Determine uncorrected visual acuity and best spectacle corrected visual acuity. Perform a complete slit lamp examination to assess the cornea condition and presence of corneal opacities. Careful pachymetry readings should be taken and recorded. Measure the corneal thickness all around a 5 mm optical zone. It is important to discuss with the patient about his condition and treatment options, including Keraring implantation. Use the nomograms provided as a guideline to select correct Keraring size and position for each case. Keraring, intrastromal corneal ring segments. One key element for the success of the Keraring procedure is its correct surgical technique. Mediphacos has developed a series of surgical instruments especially designed for each of the surgical steps required for Keraring implantation. All surgical instruments are precision crafted from titanium and are offered in surgical sets for manual or femtosecond laser dissection techniques. Keraring, intrastromal corneal ring segments. Nomograms. Mediphacos provides advanced nomograms for Keraring implantation. These nomograms are based on topographic, refractive, and pachymetric data and provide clear guidelines for implant size, selection, and positioning. It is possible to use one or two segments of variable thicknesses and arc lengths, allowing the surgeon to customize the treatment according to the individual needs of each case. Keraring nomograms are constantly updated based on statistical analysis of results and the cooperation of expert surgeons. Mediphacos also provides a surgical plan advice service, which can be accessed through the email address keraring@mediphacos.com.